So I think bladder wash is one thing that I can share with you guys that's sort of new to me. Sampling, you all know that you take you select a vein, a prominent vein that is has a good diameter, is prominent, easy to spot, and easy to fix. And you withdraw the blood from that vein, and you take that in different colored vials like purple vial or red or gray or sky blue colored. Depends on what kind of test you have to run on those vials. So we'll talk about those vials in different video. For this video, the bladder wash is something that I want to talk about. So first thing is that what is bladder wash and why do we do it? What are the indications? So bladder wash is simply that is prevention and treatment as well for for what is that cystitis, that bladder infection and inflammation. So if a patient is there of urinary retention, or there is a patient who has Foley's catheter put inside his bladder for a long time, and any patient that is at higher risk of developing cystitis, bladder infection and inflammation, so we perform bladder wash in those patients. So how do we do it? It's very easy process. So it's very easy, like you have Foley's catheter placed in the place. Foley's catheter that comes in different sizes like red, orange, gray color is there for the younger children or younger age. For adults, we use orange and red. So Foley's catheter would be in place. So what do? We just disconnect the Euro bag, and then we connect this that channel of Euro bag with that IV line, and that normal saline would be there, put in the place, and that we can mix betadine with the normal saline, or we can also add different other antibiotics like metronidazole or other antibiotics to to make it more effective. The bladder wash, we can, like, today we perform this with only normal saline and betadine. We mix 20 ml betadine in that 500 ml that bottle of normal saline. We can also use 100 ml of that metronidazole instead of betadine, because it's also antibiotic. So whatever the can kill those pathogenic bacteria. So that's how we do it. We simply disconnect the Euro bag, and we connect that IV tube of that is connected to the normal saline and betadine, mixed with betadine, or it is mixed with metronidazole. We simply connect it with that channel that was earlier connected to the Euro bag, and then we just turn it on, and it goes. It fills the bladder with that whatever thing we're using, either it is betadine, normal saline, or metro. So after that, when the whole normal saline is finished, so the bladder is now full with these whatever thing we're using for the bladder wash. So now again, what do? We disconnect it, and again we reconnect that Euro bag in that channel, in that Foley's catheter, and now again we drain it as a similar, in the same way. When we drain the urine, exactly the same way we drain the liquid that we used for bladder wash. So whatever we used earlierly, it will be drained out by that Foley's catheter in the Euro bag, and this is how you do the bladder wash. So it's very easy procedure and very effective in preventing and treating that cystitis. Okay, so this is how we perform the bladder wash. It's a thing that I learned today. I had observed it earlier as well, but today we performed it. And what else? There are a lot of things to talk about, like samplings, how you perform samplings, how did we learn it. We were very poor in withdrawing blood sample from the veins. It was like we were puncturing patients like multiple times, every time, 2 times, 3 times, to take out the blood sample. But now that every day we're doing it, we are now trained, and we are confident enough to take out the sample in just one try, one attempt. Most of the times we succeed in one attempt. Only few patients, like old age patients or non-cooperative patients, it's sometimes it's quite difficult to take the vein from the middle cubital vein or from the arms. But femoral vein sampling is a wonderful alternative for that. for non-comorbid patients, or in the patients who are very lean and thin, or very obese, that you can't spot a vein, you can't even palpate the vein, where are they, and it's just makes the task too damn difficult, to if you can't spot a vein, where is it, then how the hell would you insert your needle in which place, in which direction. It's like a blind attempt, to insert your needle without knowing the place of the vein. So femoral vein sampling is an amazing alternative, for withdrawing samples from the veins. So what do? You just have to. All right, I think the video would go long, but okay, we'll talk about femoral vein sampling. We'll talk about these sampling, that different colored vials. We can also talk about dressings and all sorts of stuff. So that's all for today. We talked about my routine, my how today was the call day. We talked about our bladder wash, and in the next video, in another video, we talk about the samplings, different blood vials, ECG, and Foley's catheter, femoral vein samplings, and what else? What else? RT tube insertion, that still I have to master, still I have to learn. Foley's, Foley's I've learned very well. I'm able to perform it, but RT two attempts, but two attempts both failed. Not a single one succeed. But yeah, we will try more. We'll learn it. So that's all for today's documentary, brother. See you in the next video. We'll meet again for sure. There are a lot of duties to do, a lot more days. We got the whole year ahead, and I think every day we'll learn something. Every day we'll have something to talk about. Every day it would be interesting. At least, at least one thing would be interesting to talk about in the whole 10 or 12 hours of duty. At least one thing would be there, to talk about, to share about. Yeah, I think these little things would keep me going, because there's a lot of frustration, a lot of tension and stress because of this, overburden of work, and we had never been, pushed so hard for doing duties like these. It's our first time, and of course we feel stressed and tense. But yeah, things like these, they make life easy, they make your day easy and make you relaxed. So of course I will, even if I would come late at night, I would somehow manage to record a video of 10 or 15 minutes, and that will do the job for the day, I think. So see you guys, see you in the next video. Bye bye, see you, take care.